If you can't breathe, you can't think. This is a fundamental fact that we sometimes forget. And I can't tell you how many cases I've had of ADD, anxiety, whatever thing. And I'm talking to the family and I'm like, so how does your child sleep? Oh, he tosses and turns all the time. He wakes up 3 times in the middle of the night. He's snoring, he's gagging, he's choking. I'm like, wait, what? Yeah, he does all of this stuff. I'm like, did anyone talk to you about his sleep? No, they just said that he has ADHD, so they put him on a medication. If you can't breathe, you can't think. This thing, this brain, is so absolutely sensitive to any type of oxygen deprivation. And guess what? For the 8 to 12 hours, depending on how old you are, that you're sleeping, if you're not getting oxygen to this thing, and you're waking up multiple times because your oxygen levels are dropping too low, so you basically haven't slept all night, do you think this thing works? Do you think you can focus? Do you think you can concentrate? Do you think you can learn? Can you feel good? Or would you have anxiety, ADHD, learning disability, foggy brain, poor memory? All of these things happen if you cannot breathe. And the primary time that happens is at night. Because during the day, what do? We go. You just thrust your jaw open and you open up your airway so you can breathe. You're aware enough to do that. It's not optimal. Guess what happens at night? You're laying back, your jaw is closed, your airway collapses, oxygen drops. You basically suffocate multiple times during the night. And when you suffocate, your brain is like, well, shoot, I've got to wake him up because I don't want to die. If you can't breathe, you can't think. And this is something that we need to all be aware of because there are many cases of anxiety and ADHD and learning disability out there that are none of those things. They're actually obstructive sleep apnea. And this is well documented in the literature. This isn't just, smoke that I'm blowing up your... This is well documented in the literature, except for some reason we're not aware of this. I'm blessed because I have one of the smartest ENTs as one of my teachers and mentors, Dr. Saru Sagi. That guy is just off the charts genius. And I'm so blessed to have had him and others like Dr. Sherry Sammy actually help me understand this. Because I wasn't aware of it even a few years ago. I can tell you in my residency, I was taught how to look for obstructive sleep apnea, but it wasn't part of our curriculum of if you have ADHD or your kid has ADHD, you need to be thinking about these things. This is not what doctors are taught. They know it. And if you go to an ENT and they look, they're like, holy Jesus, yes. And I can't tell you how many kids that I've had where some of them things were just so bad that we had to go for surgery. And then all of a sudden, anxiety disorder gone, ADHD gone, kid is happy. And this may be not your kid. This may be your spouse. It may be yourself. You may look and be like, God, yeah, I don't remember the last time I woke up with feeling good. I don't remember the last time I woke up feeling refreshed. My God, yeah, my memory is kind of cruddy. Yeah, I do have a foggy brain. Oh my God, yeah, I do feel anxious. And yeah, my spouse has been telling me I snore all the time. There is something you can do. This is not just how things have to be. And the other thing that's really cool is if you get really into it, through diet and supplements, through colostrum products, through gluten-free, dairy-free, hypoallergenic, low inflammatory diets, you can actually shrink the tonsils and open up the airway and fix it that way. There's a ton of options, but we need to be talking about these things. We need to be thinking about these things. And instead of just throwing medications, and I've said it before, I'm totally fine with medications. If medications help, if they serve a purpose, fantastic. But you know what? If someone has obstructive sleep apnea and we miss it and we put them on medication, they go into heart failure. They start developing pulmonary hypertension, which ultimately causes all kinds of horrible issues down the road. Sleep apnea is not something we want to joke around with. We don't want to play around with it. And we need to take these things seriously and be aware of them. And this is part of what this message is about, to put this information out there and have all of us be thinking about this. Have all of us be aware of this, because you know what? If a kid can't sleep, if they're choking and gagging and tossing and turning and they have these issues, Get them to sleep well and then see what happens, because it could be miraculous. And I've seen it so many times where I'm just like, yes, Johnny is back. Oh my God, look how well he's doing. This is a possibility for all of us. We just need to be aware of it. Thank you for watching. This is Dr. K.